Today we're going to start on the left bundle branch block, and of course we have to start with a little bit of conduction anatomy. From the bundle of His, the left bundle comes off, actually splits into two different fascicles. The left anterior fascicle, which runs along the anterior wall of the left ventricle, and the left posterior fascicle, which runs along the posterior wall of the left ventricle. And so let's talk briefly about why we see what we see on the 12-lead EKG. So once again, we're going to talk about V1 and V6. Those are our main leads that we're going to be using to identify bundle branch blocks. And so from the AV node, the impulse travels down the bundle of His, down the left bundle, and then let's imagine we have a block, right? We have the left bundle branch block here. And so what's happening is that the impulses will continue down the right bundle branch block as normal. There's nothing wrong with the right bundle, but if you notice, this arrow is actually moving away. Every impulse at this point is moving away from V1. So you're going to get this very what's known as deep S wave in V1. Since the right bundle has depolarized normally, there's going to be now a right to left, very slow myocyte to myocyte conduction from the right ventricle to the left ventricle. Now, looking at the perspective of V6 in this situation, all the impulses in V6 are coming towards it. For that reason, it's going to be entirely flipped. In V6, we're going to have a prominent R wave. So what's the exact 12-lead criteria? You're going to have a wide QRS greater than 120 milliseconds, deep S wave in V1, and a prominent R wave in V6. So in V1 out here, you're going to have that deep S wave there out in V1, and you're going to have a prominent R wave out in V6.